Hi, can you see me? Good. It's been a minute and I'm happy to be here. Hi, nurses. I hope you can see my board. Today we're going to talk about visas and politics, nursing shortages, NCSB updates, what to do as an internationally educated nurse who wants to work in USA. You're going to see my face in a minute, and I hope this presentation it's Hi, can you see me? Good. It's been a minute and I'm happy to be here. As I said, we're going to talk about these issues right here on this board, and I get so many questions. I am able to speak from my own perspective, from research, from my first-hand experience as an international nurse who migrated to the US, and it's working in the US. First-hand information from me to you. I am not an immigration expert or an advisor. I am the lead consultant of USRN Pathway Consult, and my name is Priscilla Kumar, and I am happy to be here and hope this presentation ends up very fruitful and helps somebody. I get questions from my nurses that are already with the consult, those who want to enroll, those who have the interest in coming to USA. What are my chances? We're hearing a lot politically in the news. What should I do? I have all the tea and update for you this minute. Nurses, so this is the board. We're gonna start with one topic at a time. So, visas and politics. I know that you've been hearing a lot in the news. You're wondering, does America need nurses? Are they still taking international nurses? What kind of visa can I come on? What am I hearing about H-1B? You have to pay $100,000 to get in. All these news in the media. It's scaring a lot of people who still have interest in coming to the US. A few of you have reading NCLEX already and you've passed. And some of you just want to start a journey, or somebody is in the process of writing NCLEX in a few days to come and wondering what is my future like. Is it worth pursuing? I get this question at least 5 times a day as somebody who runs UPC as a lead consultant, and my team members also get this question a lot. So yes, the different categories for nurses to come on to work in the US. What most of you know is EB3, Employment-Based Visa Category 3, and that will definitely give you a green card. And if you have the interest of becoming an American citizen, that is the right path to pursue to get your citizenship to be an American. H-1B is fast. It can take between 4 to 6 months to get to the US. It has a few requirements. You have to have a bachelor's degree, obviously a skilled worker, a registered nurse, allied health professionals, pharmacists, or if you haven't, a unique skills, if you're in engineering. I know so many Indians that came through H-1B, and unfortunately for them, the contract is over and they have to return. I also know for a fact about 50 nurses from Ghana have been stranded lately, and they are trying to figure out how to go back to Ghana because the contract they came on was for 2 years and it elapsed, and then the hospital said they can't afford to pay them anymore because they come in as contract staff and there's a budget as to how much you can offer these nurses, and after the job is done, the hospital thinks they are going downhill in terms of being bankrupt. So what do you have to do? You have to cut off some employees. So obviously their contract staff would have to go back because they take a chunk of the payroll. And then you try and maintain your staff and try and analyze the issue and sort it out. So yes, some 50 nurses in the Washington, D.C., Maryland, Virginia area from Ghana were caught up in this issue. This is real information, first-hand information that has come to my desk. So be careful what route you decide to go on. I know you want to come to America so fast. I know you want the process so fast. You can't wait for 2, 3, 4, 5 years to join us here in the US. So you don't want to wait for the longer process, which is the most guaranteed, the EB3 category I already spoke about. So you're trying to come in quick. H-1B has very strict rules and regulations. So when you're trying to consider that route, make sure you read very well, do your research about that route. What happens after your 2-year contract ends? Are you going to be able to renew at that same facility? Are you going to go somewhere? Whoever brought you is responsible for you after the 2 years. So you can't just be jumping and getting another job on your own. It does not work that way. So they are forced to send you back to your home country. So would you wait for the longer time and come in for good, or will you come very quickly, 4 to 6 months tops, and then have to exit after 2 years. I know a few Indians that left last week because the H-1B contract they came in ended. They are now nurses, they are different fields, but the H-1B has the same rule that counterparts, and if you belong to that visa category, the same rule is going to apply to you. Don't get me wrong, I'm not saying it's bad. As I said, I'm not an immigration expert, so you can contact one yourself or do your research and also ask people who have gone through that route. The rules keep changing, so even about asking people what applied to them 2 weeks ago or 2 years ago is not what is applying today. The rules are changing. Every day we wake up with something new in the news. We are all on the urge. We are all panicking. Nobody knows the future. The healthcare leaders. I happened to go to a big conference called Health Connect South, and I mingled and interacted with CEOs from big health systems, and everybody's fear is uncertainty. Nobody knows what's going to happen with healthcare right now with all these rules that are coming. So that's about visa and politics. So keep your eyes on the news. When you hear something, go to USCIS immigration page, go read it there, make sure it's confirmed, make sure the forms you are using are updated forms, because they update all the forms, different categories so often. Don't panic. Nursing shortage is a big deal, and it's right on the board. It's one of the topics we're going to be discussing soon. We're going to talk about nursing shortage, the factors that are responsible, and what your role is going to be. There is still a lot of nursing shortage going on, as you have heard or seen in the news. Healthcare is an industry worldwide that would always survive because people are going to be born, people are going to be sick, and people are going to seek healthcare. People are going to end up in hospital, nursing homes, whatever. So if you're a professional that belongs to healthcare, like you will forever have a job, all things being equal. So nursing shortage in the US is a big deal. There is an issue where baby boomers are getting older and are retiring from nursing, and the pandemic sparked this retirement or people getting out of the job. Most nurses already had underlying medical issues, so they did not want to expose themselves to COVID, so they had to take a voluntary exit. They had to retire. Most of them are getting older. You know, nursing takes a toll on your body physically and mentally a lot. Physically, your back, your feet, you're on your feet on a very hard floor, hard as in concrete or wooden floor that is hard. You're standing on that floor, walking up that floor 12, 16 hours, 3-4 times a week. So it's a hard job. It takes a toll. You're lifting patients that 3-4 times heavier than you. So your back, your neck, your feet, it's a problem we all know for, that cuts across nursing. There are so many nursing injuries. So due to that, people are moving away from bedside. Some of us chose to also pursue other things. Some of us, my journey has been inpatient, outpatient, back in Ghana, inpatient, outpatient, back to inpatient. And then in the US, I did inpatient, outpatient, and then I hit the road, travel nursing. Yeah. So I hope by now you are watching this because you're interested, you're a nurse, you know what it means to be an inpatient nurse staff. You're working in the hospital at the bedside, pretty much. Outpatient is like clinics, doctors' offices, and that type of situation, IV, med spa units and stuff like that, outpatient or ambulatory care. So a lot of people said, look, I deserve better. I'm doing all this job. This nurse comes in, she's taking 3-4 times my salary. What am I doing here? What am I still here for? So they jump and then go out on the streets to do travel nursing. I was one of those people who joined the bandwagon jam to go see what is out there. So that is it. Nursing shortage, travel. We went to the road to make 3-4 times what our colleagues, staff nurses were doing at the bedside. It is not an easy journey. If you ask me, that's one of the reasons I've not been online as much as I used to, because you're constantly on the road. You carry your stuff, pack up, hit the road, go far away, because you have to be at least 50 miles away from your home address to be able to make travel stipend or travel allowance. You can't just do it around. There is local travel and there's travel, and there's actually international travel where people leave the US and go to the Middle East and work in Saudi Arabia, Abu Dhabi, and all that. Yes, so you have to be gone to be able to make some income. So that is it. I will make a detailed video about travel nursing and my experience so far. In my interest, most of you want to come here to do that. It takes a few skills to be able to do that, but I have done it and I'm still doing it, so I will be able to coach you better. You know, I'm into coaching as well. So yes, that is one of the reasons people have retired. Nurses said, look, I'm out of here. I'm going to make 3-4 times what my friends are making at the bedside. They went to travel. People went into remote nursing, so people that are working from home. There are so many telehealth jobs that you can do as a registered nurse. You stay on your computer, you log in, you advise people, you work for doctor offices, you actually work for hospitals. My good friend in Texas, shout out, she works in Texas and then she works remote. She has a very unique job. She is helping you, the nurse at the bedside. She's helping you do your admission paperwork. She's helping you do your discharge paperwork. She's helping page the doctor for you. She's helping page the pharmacy. She's helping do medication review and giving you all the updates, because your patient is about to go home, this bed is going to be open, prepare for an admission, this is the part I will do. The system, she's helping document vital signs because the monitor is on and the numbers are popping up automatically, so she's putting those in. So she's assisting the bedside nurse. She has this funny title that I can't remember, but yes, it's also a role. There are so many weight loss companies right now, GLP-1 and Ozempic and co, that are using nurses as consultants to be on the computer and keying some figures, your current weight, your diet, your lifestyle, why you want to lose weight, the things you've tried already, what is working, what is not working, and then you are able to they're able to pass it on to the doctor. They review your charts. The utilization nurses or case managers that work from home see how much, see who needs what. If you need a wheelchair, they arrange for that as case managers. There are a lot of remote jobs you can do as a nurse if you do your research well and if you apply. It's highly competitive, but it exists. People are doing it, and I know a few people for a fact who are doing it. So that's also taking people away from bedside. That led to nurse shortage. Entrepreneurship. Nurses said, look, I'm done with nursing. They went to hang their stethoscope. They've gone into business. Some are health related. People have opened IV spas, spa treatments that are IV therapy, the banana bag, and all sort of electrolytes that they infuse. Be careful, you gotta get a license to be able to do all that, and just make sure when you're going to seek those resources, you go to a place that is certified, they know what they're doing before they give you something that will throw off your electrolytes and you end up in the hospital. So nurses are doing that. Nurses are going into strictly selling other things. Nurses are opening salons. Nurses are doing my hair. The person who does my locks, she's an RN who doesn't practice nursing anymore. So yes, people have left bedside. They said, I can do a business and make money. Nurses are going into real estate. I do some of that. So yes, you can do so many things, and that has led to nursing shortage. So how do you come in? Because they've left, there is a gap. And US is trying to fill the gap by getting people to come and work. Healthcare workforce. Reading one of the papers recently that I'm working on, and it talks about workforce, nursing shortage, and how to get healthcare workers, pretty much, not just nurses, but we hammer a lot on the nurses one, and this channel serve a lot of nurses, but allied health in general, help people in health